Okay, whenever you do the toxicology studies, particularly if you work on kidney, so in toxicity studies, what generally you measure is biomarkers related to kidney damage or serum creatinine and blood urea nitrogen, because these are routinely used biomarkers of kidney function. So I'll just talk about little history about these biomarkers and the new biomarkers which have been invented because of the limitations of the previous biomarkers. So I'll tell that also what were the deficiencies of earlier things. So in 1900, blood urea nitrogen, which is the byproduct of uh, urea, is measured for the assessment of kidney function. Then after, serum creatinine is used as biomarker of kidney function because it also gives you the idea of kidney function. But that serum creatinine and in today's world also, serum creatinine is considered as a gold standard of kidney function. But this has poor sensitivity and specificity. So here you need to understand the three things which are limiting in detecting serum or limitations with the serum creatinine measurement. One is serum creatinine levels are affected by body weight, nutrition, metabolism, and other factors. So this is one disadvantage, you can say. Serum creatinine level increases if more than 50% of renal damage happens. So you are not able to detect the early stage of kidney diseases. Only you will detect after 50% of renal damage has already been happened. And next thing is, see, this marker does not reflect the tubular injury, because kidney is made up of like each nephron is made up of glomeruli, then proximal convoluted tubule, then loop of Henle, distal convoluted tubule, and collecting duct. So you should be knowing where actually the particular agent, if it is causing damage, then at which part it is causing damage. So there are recently there are various biomarkers for kidney damage detection depending on their stages, like early stage kidney detection with progression, and one is depending on the site where they are affecting. Now I'll talk about two biomarkers which are used to detect early stage of kidney damages. One is serum creatinine. Okay, I'll talk another biomarker also which is related to kidney function. But here, two main biomarkers are which detect kidney damage. One is KIM, that is KIM1, that is kidney injury molecule, and second one is clustrin. So these are two biomarkers. So what is the difference is, KIM1 is the biomarker specifically detects the proximal convoluted tubule injury, whereas clustrin detects the distal convoluted tubule injury. And this is, but what if you want to measure, this is the, because these biomarkers only detects the injury, but in terms of function, if you want to measure how this kidney overall functions, so functional biomarker is third one, that is cystatin C. So this has been used as functional biomarkers. So overall these three biomarkers will help you in diagnosing the diseases at the earlier stages, and in terms of structural as well as functional damages to kidney. So in this way you can include these biomarkers in your toxicology studies in order to assess the kidney injury, or if your molecule is designed or destined to have this kidney toxicity effects.